My name is Rosalie. In my proper job, I'm a receptionist. I've been volunteering at the Royal Berkshire Hospital now for over 30 years. My children were born here, all three children were born here. My eldest spent a lot of time in casualty because he was very forward in what he was doing, always having accidents. And they put out appeals at one time to help. They wanted people to serve behind the coffee and tea for patients coming in, so that's how I started. Then I became one of the first welcomers here. Sandy was our leader then. I became a welcomer, and I've just been involved since. I came here most months attending different things. A few months ago when this all happened, I thought I could do a bit more. I've been a patient leader now since it started. I'm a member of the oncology team here for many years, and I just thought I would like to do a bit more. So I volunteered as a driver. Coming back and forth, I learned that the frontliners here were using the PPE, were suffering from dry skin and needed hand cream, toiletries and different things. So I then put out appeals to the local Facebook teams and Wokingham Press, asking for donations of toiletries, creams, anything that would help. And I was overwhelmed. I've been delivering now car bootfuls for over 7 weeks. They're little packs of toiletries, which the person who's donated them has already put them into bags, hand creams, face creams, lip salves, and also lots of scrub bags, which have been made. After delivering here, I'll be picking up some gowns and taking them to a seamstress to be altered for the hospital. If we all avoid the hospitals, then who's going to help the people who are helping us? So I think that is why I get involved, and that's why I come along and do it. Because without everyone here, we wouldn't survive. So we need each other, and that's why I love to come and do things here.
Well, my name's James Burton Stewart. I've been a volunteer at the RBH for 21 years now in hospital radio, where I've been a producer and a presenter since 1999, and that's how I first met Kirsten. And when COVID-19, when the outbreak occurred, she very kindly contacted all of us who are registered as volunteers, asking if we could help. And as I was on furlough from my normal work, I'm only too pleased to help. Well, I've worked for 29 years in the car business in Reading for Jardine Motor Group Lancaster. We've been furloughed, and it's been an absolute pleasure to be able to make a small contribution to this magnificent effort that people have made, your volunteers have made, and I'm honoured to have been able to be part of it. Well, I've always loved radio. I think radio is a fantastic medium, and the opportunity came. I had some time on my hands, and I thought, well, what can I do? Want something new in life at the time. It's something I'd always wanted to do, so I wrote to hospital radio. It was the Battle Hospital back in the days, and as luck would have it, they had a vacancy for Tuesday evening, and I've worked on Tuesday ever since. So I've been asked on a number of occasions to participate in the programme that was set up to collect the ventilators for people with sleep apnea that weren't required, and they're going to be recycled and used as respirators. And we've been hither, thither, and even Yong, Basingstoke, Four Marks, Tilehurst, all over the place picking those up. That's one thing. The other function has been collecting items that your amazing sewing ladies have been busy working on, and also taking them out fresh supplies of gowns like these ones here, in fact, so that they can do the necessary modifications on them. In my opinion, you wouldn't ask your volunteers to do something that wasn't safe. Got the rubber gloves, got the hand sanitizers, got face masks, you know. I don't think that you've asked us, you certainly wouldn't ask us to do anything that was in any way risky. Why not? You know, I'm delighted to help. Well, first thing I would say to anybody thinking of volunteering, do it. It's great fun, and you meet some really lovely people. There's a fantastic atmosphere in the RBH, and it's a lovely thing to be part of. It's been a pleasure to have been asked to be involved in the works during the COVID emergency, and what an amazing job the voluntary services have done in coordinating the whole thing, and it's been my pleasure to be part of it.
My name's Mark Unstead. I'm a respiratory physiologist and I work in the chest clinic in respiratory medicine. A CPAP machine stands for continuous positive airway pressure, which means that we would normally issue this for outpatients who have obstructive sleep apnea. Some of the learning outcomes from Italy, who are maybe 2-3 weeks ahead of us from the perspective of coronavirus, were that CPAP machines helped protect intensive care beds. So if you are an inpatient with coronavirus and struggling with your oxygen levels, one of the best ways to protect people going to intensive care and their beds becoming overwhelmed was to give them CPAP and lots of oxygen. So immediately when that outcome became available to the general medical public, these machines became an essential item and very hard to get hold of. So we had some what we would call floating stock or clinic stock in the department, but we needed more. If you looked at some of the projections of the worst case scenarios, without CPAP machines, we were potentially going to be overwhelmed in intensive care. For one reason or another, when you're issued a machine, sometimes if you lose weight or if you have particular types of surgery, the obstructive sleep apnea can sometimes disappear and you no longer require the machine. So it's a bit like having a crutch after you've sprained your ankle. It's one of those things that you think, I must return that, and never get round to it. And at this time when we needed it, volunteers were able to bring it back to us. So we asked patients who weren't using their machines anymore, who had them maybe under the bed or under the stairs or tucked away somewhere where they didn't need them, to return them. But of course with lockdown, it was very hard to get people to come to the hospital or indeed just to be able to get the equipment into the trust. So we would have had to send clinical staff out to pick these machines up, taking away clinical workload from the wards, where at a time where we were stretched with staffing and resources. The volunteers picked up over 100 machines in just over a week. To have this extra stock of machines back in at that time and in moving forward in this present time is amazing. One less thing for us to worry about.